All right, thank you, Oshin, for such a lovely introduction, my friend. All right, I want to start here with a show of hands. Please raise your hands, please, if you've ever gone to do a dental checkup. Please. Thank you. What about an eye checkup? All right, most of you. What about a hearing checkup? Oh, surprisingly, a lot of people. Well, I haven't. Do you know that only 1 in 20 people do a hearing checkup, actually go to the doctor to check their hearing? And even if you admit that you have a hearing problem, it takes you up to 10 years to do something about it. So to take it even further, what if I told you that there are apps that can actually help you prevent your hearing, and even gaming apps that can help children work in the hospital to prevent nerves or anxiety during very scary treatments such as chemo and radiotherapy. Now, I know what you're thinking, how is she jumping suddenly from hearing loss to cancer? But that is precisely why we are bringing such diverse speakers in here, who are using the gaming approach with apps and, with VR technology even, to either prevent some conditions or even to ease the nerves when you are about to be treated with some. So let's begin here. Amanda, I want to start with you. You used to work at the NHS, the publicly funded healthcare system in England.
When this is like this,
and
bang.
then
When this is like this, it's okay. So
and then you went on to co-found Eargym, which, as the word says, it's designed to exercise the hearing muscle. So tell us, why you decided to use the gaming approach to tackle hearing loss?
Thanks very much, Ariana, and thank you for this session. So we decided to tackle hearing loss because hearing loss is the biggest amenable factor in dementia. So 8% of all dementias, hearing loss is the biggest factor. And that was a real shock to me, even after nearly 30 years of commissioning healthcare in the UK. So one of the reasons for that, you've mentioned how few people get hearing checks and how long it takes to do something about it, but is this massive fear of losing our hearing. We think if we wear hearing aids, we think that we are old, and that indicates frailty. So the average first-time wearer is 75, and by that point, you've been losing your hearing for a very long time. So we looked around to say, well, how can you get people to care about their hearing much, much earlier and take action to prevent hearing loss or to improve their hearing when hearing loss is happening, or maybe to assimilate with, getting used to sounds that maybe we don't hear until we use hearing assistance. So gamification, we thought, was the best route to get people to feel that they can do something without signaling that they're getting old and getting old, towards the end of their lives. That was our gear. So one second point is that we also realized that most people don't know that hearing loss can be prevented. So the opportunity is in auditory training. So our hearing aids affect our sensory neural mechanism, the hardware that takes in sound. But our brain, our auditory cortex, makes meaning of that sound. So is it an alarm bell, or is it a call to food, for example? And so you need to apply meaning. And if you practice applying meaning, if you practice listening, you can improve your overall hearing capacity by up to 25% in as little as 7 weeks. And we thought that's got to be the opportunity that we go for in improving hearing over a lifetime, and hopefully improving cognitive well-being for life as well.
So I was saying a little bit at your application. You have a very well done video about it, and the way it works is that you have several sounds coming from different parts, and you have to practice hearing and practice identifying where they're coming from. Is that it?
Yes, so we use binaural audio. We record in binaural audio, so the sounds come from around you when you wear your headphones and you're using your smartphone. And we use our games to practice hearing skills. So the most common way that we describe your hearing skills are detection, localization, discrimination, and then intelligibility in silence and in noise. So our games are designed to feel like real life. So you might be a barista, for example, ordering coffee, or you might be searching for sounds in different environments like woods, for example. And they take 2 or 3 minutes to play a game to practice these different hearing skills. That transferability to real life is what really matters.
All right. I want to get to that deeper in a little later, but for now, I want to hear more about Thomas. Now, you are basically, or you have developed a system to, again, ease the nerves, ease the anxiety, ease the fears of many children when they have to spend long hours or even days undergoing treatments at the hospital. So can you tell us a bit more?
Yeah. So our mission at Nixie for Children is to make sure that children have the right information they need before they go to a treatment to ease their fear, as you said. And what we found out is that the ideal solution would be to take the children into a surgery room, for example, and letting them see by themselves what's the surgery room like, but this is not possible. So that's why we use virtual reality. So we train them. We did a 5-step program that's really easy to use for the family at home, so they can see using a cardboard headset what's the surgery like. And Nixie, which is a 3D animated character, shows them what's going to happen, and then all the information that we give them, we want them to absorb it. So the way children absorb information is by playing. So that's why we use a medical play plush toy like that one. And then they can, everything they learn, they do on the plush toy. So by the time they go back to the hospital, they already know things. And we can see that anxiety decreases. We can avoid sedations in treatments that children need to stay still, but they're afraid, so they move, and they do it under anesthesia. Just by giving them the right information and letting them play, they can stay still, and we can avoid like 30 or 40 anesthesias day in, day out for our 5-year-old children, for example.
All right. Can you show us a little bit what we can find in that game? I saw that in the back part, you can actually take out some parts, carton parts.
Yeah, so the idea at the beginning was using virtual reality. So the idea is that children would go into the surgery room, but pretty early on we found out that we needed more, and that's why we added 4 more steps. And the first step is that the family knows what's going to happen, so they can answer all the questions of the children. This is information. The second one is a booklet that lets them play and draw, so we can see how the children understands their role in the treatment. Then they see the virtual reality, and then we use the plush toy to do the treatment to Nixie. So all the clothes can be taken off. For children with cancer, we have this plush toy that's special because the hair can come out. And then they have all these parts that they can put into Nixie's backpack, so they can play at home, and then when they go back to the hospital, they already know what's going to happen.
So you have a thermometer in there, and you have a little bit of everything.
Yeah, sure.
Okay.
An anesthesia mask, everything they need.
Okay, so Amanda, again with you, what's very interesting is, like you said, people often associate hearing loss with old age. So how have you motivated many younger people or the younger generation to download your mobile applications and start practicing those games to exercise the hearing?
Yeah, we've spent the last 2 years doing a really intensive user-led design process that was funded by government research grants, so very valuable. So we recognized that we asked people why there's this barrier apart from the fear of growing old or being perceived as old, and it was also time. So people don't want to take the time to go to a high street audiologist or go to the local healthcare services to have a hearing check. But also, there's, as I said, these 2 parts. So you've got your pure tone audiometry, which audiologists and hospitals will do. But you also, there are more, the other side of the checks is how your hearing level affects your life. So there are different checks that you can do more easily online that will help you to understand whether or not your ability to interpret sound makes sense. So it's the barrier of time. We developed a 30-second frequency slider that we lose frequencies at different decades in our life. And 400,000 people have done that 30-second slider, half of whom are aged under 24. 70% are aged under 35. And it's clear that we are meeting that need of doing a very quick hearing check to give us a clue about how our hearing is. And what we find is on that frequency slider. If your ear age turns out to be significantly different to your chronological age, then they will move into the next test, which is 3-4 minutes long. So convenience, quick feedback, all of those things have helped us to address that younger audience.
So what happens if I have the hearing level of a person aged 55? Is there a way to reverse it? Is there a cure for that, or am I completely lost?
No, that's a brilliant question. I'm 57 and I have the hearing. I wear hearing aids, and they really help me in social situations and things. But if I don't wear my hearing aids, on that quick check, my hearing age is 85. So the hearing of a 55-year-old is not the hearing of a 35-year-old or a 25-year-old. Clearly, I'm going to be more likely to have some decline. But the opportunity to practice listening, which is what we offer through our games, means that in 4 weeks, I improved my overall hearing capacity by around 20%, measurably improved that. So I can't make it perfect. I can't repair lost hair cells, but I can improve my overall hearing capacity by paying attention, basically.
So it's like doing a little bit of physiotherapy, but with the hearing, with the ears?
Yeah, I mean, that's very much behind our name, Ear Gym, is because it is giving your hearing a workout. That's exactly what it is, and we want people to think about it exactly like that. It's as easy as brushing your teeth.
Great. Now, I wanna know, Thomas, speaking about younger age, how did you implement this in the hospitals to deal with children? It's such a delicate topic as well, so how, and where can we find this?
You can find it in the hospital. So the idea of our product is that the hospital gives it to the children. But
which hospitals? Is it all over Spain, all the hospitals, or just a certain amount of hospitals?
hopefully soon all of them, but 25 by now. But the idea to implement a solution like this in the hospital is to understand really well how the hospital works. You said something really interesting, Amanda, about that people don't want to put the time in. And it's the same with children. Children don't want to do homework. They don't want to be explained everything. They just want to play. So the idea about serious games and stuff is that we make information more available, and yeah, that's how we do it. So we needed to implement a game inside a hospital, understand how the hospital works, and make it really, really easy to use for the hospital, because if it takes time of the professionals, maybe you are taking time out of other important tasks, so the hospital won't implement it in the long run. So the idea was to see what's the journey map of the children when they go through the hospital, which is all this process, and where is the most important moment where the children is available and is open to receiving this kind of tools, so the hospital can just give it to the family. And then we did it really easy to use, so it could be used at home. So it's delivered in the hospital, but the families actually play at home.
Okay. And you use also the VR glasses and all that?
That's why we use cardboard headsets. We could use better headsets that have more resolution and more everything, but then it makes it difficult for the implementation. So we chose an easier headset.
And more sustainable too.
Yeah. And at the same time, we win that the game can be done at home, so it can be shared with the family and brothers and sisters. Even we found children that took the VR headset to school to show all the other colleagues in the school what's going on in the hospital. So it's important to have you also said patient-led design. So you have to have the patient in the middle and then see what's the process of this patient and then create something that's tailor-made for them and for the stakeholders, which is the hospital.
All right, and let's dive deeper into the challenges. Going with you, Thomas, again, we're talking about hospitals. Hospitals are among the most difficult industries to get in and to partner with. So again, how did you manage to convince hospitals to give them your games, your toys to the children?
Well, I think there's a long way still to go in humanization in the hospitals. And there's a return on investment thing in the hospital that I think should be more encouraged in the hospitals, to measure things that cannot be measured by the money you are saving, but by the experience of the patient and the mental health of the patient. There's a long way still to go. But we are seeing a lot of good feedback from hospitals and a lot of willingness to try new things and try things like Nixie, and to not just try it out, but buy it and implement it, which I think is really good. It talks really well about our health system.
Excellent. So 25 hospitals around Spain, and hopefully all of them, and maybe even
Hopefully soon.
internationally. Okay. And what about you, Amanda? Any specific challenges that you faced when developing this app?
Yeah, so the first one I think is just that gamification is great for addressing the extrinsic factors of motivation, the thing about reward or praise or recognition, but it doesn't change the fact that you need the intrinsic motivation, you need the desire to change in the first place. So we had to take a step back from saying, here, you can train your hearing, to making people want to train their hearing, want to think about their hearing in the first place. So we have developed the app to be to put much greater concentration on enabling people to find out how their hearing is. Just to take a few minutes to check their hearing, compare it to their age, think about how it impacts on their lives, all with reliable and scientific checks that we've incorporated, so that they can make a choice about whether or not they want to train their hearing to do prevention. Or maybe their check says actually their hearing's declining and then they train to improve their hearing. Or it might be showing, for example, with neurodiverse conditions like auditory processing disorder, sometimes practicing listening in a safe space can make it much easier to live with sounds that are alarming in a wider world. So, bringing it forward in terms of raising awareness and helping to drive people's desire to look after their hearing is one of our first bits of learning.
Very briefly, before I jump to my last question, how young should I be to use your app?
You can be any age, but as a newborn, you get a hearing screening in most of Europe, I think, at the moment. It would be good to check your hearing like you do as often as you check your eyes. About once a year, all the way through life is a good idea.
Well, thank you so much. My last question then, and a couple of seconds here to respond. Both of your initiatives use gamification to address health issues that people rarely want to talk about. So how do you measure the effectiveness of your games in reducing stigma and fear?
I go first.
Thank you. So as I said, we do user-led design, so we do an awful lot of user feedback on how people feel before and after. So our training program currently is you take a check, you do about 4 weeks of training, and then you take that check again and see the change. And then we ask people for qualitative responses about how they feel, and with the feedback on their increased confidence in social situations, their sense that they feel better is really important. So their personal confidence brings them back into the setting. So they won't, people with hearing loss retire 7 to 9 years earlier. So
3 seconds, okay. Yeah. Okay. I have to wrap it up, but in 10 seconds, how do you measure your feedback? The effectiveness.
Real quick, we did a clinical trial. We compared a group that did the same process as usual, and then we did a group that had virtual reality for training, and then we compared the results of the anxiety levels of each one of them, and that's how we know that Nixie works.
Okay, and a huge progress.
Yep, yeah, it's going well, yeah. And not only in anxiety reduction, but also in sedation avoidance, which is, great results.
Excellent. If you want to continue this conversation, they will be happy to answer further questions outside. Thank you so much.
Thank you so much.
Excellent.